Hi everyone, my name is Monet Darby and I currently attend the Jackson State University as a sophomore psychology major. But today I'll be discussing racial bias in the healthcare industry. When we discuss racism and acknowledge it, we must remember that racism extends beyond social interaction. We must remember that racism actually affects healthcare, housing, and employment opportunities. There is a long history of medical malpractice, such as from practicing surgeries on black enslaved people, from the Tuskegee experiment, and racial bias in healthcare algorithms are just a few reasons why black people do not trust or rely on the healthcare system. Statistics show that people of color are more likely to face healthcare disparities. The National Center of Biotechnology Info and National Library of Medicine show that and state that people of color are more likely to suffer from stroke, diabetes, obesity, preterm birth, HIV/AIDS, hypertension, and so much more. Discrimination and implicit bias from healthcare providers influence treatment options. So this also results in failing to provide interpreters, different treatment options, and doing more or less diagnostic work. So recent study showed that medical school students have racist bias, basically common biases such as black people do not feel pain or that we have a higher pain tolerance than other races. The National Women's Law Center also states that black women are 4 times more likely to die during childbirth, and they're more likely to have preterm birth, regardless of class in comparison with other races. They are also 2 times more likely to lose a baby in stillbirth. So, racism, life stress, epigenetics, and physiological stress affect black birth outcomes. For example, black people have only had the right to vote for 60 years. So most of the time where our parents were fighting or trying to vote, they were pregnant with our parents, our aunts, and our uncles. That direct racism and stress that they gained from that was passed down to their parents, which is also passed down to us. So we can also compare epigenetics to people that are predisposed to things such as alcoholism or substance abuse that is in their genetics. So in a way, we do feel pain that our ancestors and our grandparents felt. So now black people are trying to explore options by using alternative holistic healthcare, changing their diets, and seeking out black physicians. Black women have started to get doulas for solutions to maternal care, and this has been an increase in home birth and midwifery. States such as Oregon, New York, and Minnesota have mandated that insurance companies cover doula operations and costs or reimburse certified doula operations costs. California passed a Senate bill in 2006 called Bill 464, which decreased black women deaths during childbirth by 55%. Illinois and Texas have implemented racial bias training for healthcare staff. More studies show that need to be done to show that medical malpractice and for other solutions to preserve black life. Non-profit organizations are trying to combat this by offering free or low-cost services in brown or black communities. So, stereotypes should not determine the quality of someone's health care. Again, my name is Monet Darby, and that was my speech regarding healthcare bias. And right here are my cards. And thank you for listening to my presentation. I hope you can provide many helpful pointers.